Americans spend more than $30 billion a year. I don't even really know how much money that is. I just know it's a lot.
Man.
But here's the thing. It's in an industry that's not even regulated by the FDA.
A new Vox News report just might have you reconsidering that daily supplement you're taking. The agency is reporting as many as 850 products, including appetite suppressants, laxatives, muscle relaxants, sexual enhancers, anti-anxiety drugs, anabolic steroids, and anti-inflammatories, contain illegal and/or hidden banned pharmaceutical-grade drugs. Over 100 products contained DMAA, an ingredient banned in the U.S. and linked to strokes, heart failure, and sudden death. Federal researchers found supplements cause 23,000 ER visits nationwide annually and more than 2,000 hospitalizations.
We have two parallel systems of providing medications to people. One is completely regulated, the other is completely unregulated, and yet for some reason, we as a society feel like the unregulated are somehow safer, and I think what a lot of these studies are now showing is that's just not true. You don't really know, buyer beware. It doesn't mean don't take supplements.
Sure,
it just means you better be doggone careful.
Yeah, I mean, there's hidden diuretics, steroids, seizure medications, blood pressure meds, antipsychotic medications were found to be in some of these supplements.
Well, the interesting thing about the supplements is I have so many patients who are like, I just want to do it naturally. And then they bring their supplements in.
Yeah.
Instead of taking the medication I prescribe, they bring the supplements in. And then you start reading the label and you're like, well, wait a minute. Exactly. These are some of the exact same things that we were just prescribing. But at least if you take the one I prescribed you, I know how much you're getting.
Yeah.
You know, so I think patients really have to start to understand that when you're getting a supplement for your erectile dysfunction or for your blood pressure, that a lot of times you might be getting an illegal mix of the exact same medications that we might be trying to use in a smaller dose.
You know, some of the more reputable companies will actually subject their products to an external source to verify the ingredients. And there's three labels you can see. There's something called NSF certified, USP certified, or consumer laboratories. And you'll see a little tiny seal of approval. And those companies will verify ingredients. They'll check for harmful contaminants, and then make sure that the product actually, when it was manufactured, adhered to FDA safety standards.
10 years from now, I think you'll hear us all singing a different tune. Because I think within 10 years, I would hope that this is a more regulated industry. The good companies in this space want to promote truth in ingredients. The sad thing is when you have an unregulated industry, it's a lot cheaper to throw in anything you can, put it in a pill, and if it's somehow working, you're gonna go with the cheapest possible formulation. If it doesn't matter, you can say anything you want on the bottle. The companies that are putting out these spurious products are often the ones winning. The companies that are actually going through the process of giving you what you really want, it costs them more money. It's just, it has to change. And I don't know why it hasn't. You know, I think soon you're going to see all hands on deck with this industry.
For sure.
And unfortunately, I think it'll be because they make so much money. I think anytime you have an industry that's making a lot of money, somebody says, okay, well, now let's regulate it. So I think what's going to happen is that industry makes so much money that they're actually going to start competing with the drug companies. And that's what's going to fuel the investigation and some regulation.
Well, but sometimes, go ahead.
When we're dealing with our patients and we ask you, are you taking any medications, list the supplements too. I have a long list of supplements now before surgery. If you're taking one of those, you can get into serious bleeding problems. Other things you can have, they can interact with anesthesia, they can interact with other pain meds, sleeping pills you give somebody after surgery. You can really get into trouble.
So we've said it once, we'll say it probably 100 more times. Treat your supplements just like your regular medications. That's what they are. More to come.